me kwa koje di bi ta de tin Friday na me call children's clinic ko hu nurses no amo bi za me so mo ma me tablet ni bi ana mo chere me se de mesia no na fa na me say no de refer na me ka se ne me pepa me amo starting ewo me pa me Shema bia me ko na me won so a enya me hwe
kan bia mfi se me be hie bia itimi me hia ti abo bebre ya masese nsuro se bia ankura mi ni ya wo no de bi betimi asabu je bia ni wo be bia ka ho ne bia e be stop mi ni ko ra na na den kakra ntino se de sa awo bia be ntino se no ba ko nya mfie nwotwe ba ko so se be nya nan ya wo be okuni se mu se de se na ye mu twe kakra di won zunya e ko be se mi ko be se nsia na se ni ba ko so ka ho.
It's your life, it's your choice.
Hello again and welcome back to our interview segment of the Breakfast Show. This morning we're talking about the Ghana Association of Quasi-Government Health Institutions and as to what they do, what they are here for. I have with me 3 members from the association. I have Dr. Vitus Anab BC, who is an executive member. I also have Dr. Mrs. Akwahin, an executive member, and also from the VRA Hospital, and Mr. Quasi J, who is the executive secretary. So I have 3 executives in the house this morning to tell me more about the Quasi-Government Health Institutions. That's the Ghana Association. Good morning and welcome.
Thank you.
Since you are close to me, I believe I would have to start with you. Being an executive member, the Ghana Association of Quasi-Health Institutions, what exactly do you do?
Ghana Association of Quasi-Government Institutions, we have our acronym
Okay,
GAQHI.
let me come. Before then, just give me a brief background of the association.
The association was born out of the need for quasi-government health institutions to come together to form an umbrella body. We've always been in existence, but as individual institutions. But in 1996, when the Act was passed for the Ghana Health Service, we were left out. We didn't have any identity. So in 2002, there was a need for us to come together as a group, just like Christian Health Association of Ghana and just like the Ghana Society of Private Medical and Dental Practitioners. So we came together to form this body, and the body mainly is made up of various institutions which have got health institutions or clinics or hospitals. And this, for example, Coco Clinic, VRA Hospital, GAQHI Clinic and all that. So we saw the need to come together so that we could have an identity, so that we would be able to articulate our needs and also to collaborate with other stakeholders. And so in 2003, January, we had our first forum, which took place in Legon, and we took off from there, and we have come far.
Okay.
But basically, that's how we started.
So is it more like a grouping of private and government institutions, or government institutions are out?
No, it's not private. We are quasi-government. Half governments. We are autonomous government bodies, like VRA, like Ports and Harbours Authority, like Cocoa Board. And so these are purely state-owned enterprises, but we are autonomous. And these organizations have health institutions or clinics or hospitals which provide health care. And so we came together as a body.
Now, Dr. Mrs. Akwahin, having come together over the years, what exactly have you been doing as a group?
Well, as a group, we are in the health sector. We offer health services, and because of the nature of our organizations, we offer quality health services. Our organization is a stable one. We never go on strike. We abide by the rules, the policies, and the regulations of our mother institutions. And therefore, the work that we do, our members are more committed to quality health service. And we feel that we should share it with Ghanaians, because we are there for Ghanaians and not only for our institutions. We've opened hospitals and clinics to the general public. We have also embraced the Ghana Health Ghana Health Insurance Scheme, which we are running. And there was a perception that our charges are higher. But that perception is not true, because when we did the survey, our fees are just like any other public institution. Because if we want to charge the fees that we actually would, then most Ghanaians will not be able to use our facilities. And because of that, we haven't. And we have used the National Health Insurance to make it affordable to all Ghanaians, but at a very high quality.
Okay.
And we think Ghanaians also deserve the high quality that we give to our institutions. They should also enjoy that facility.
It's more like paying less for good quality.
Good quality, that's right.
Now, Mr. Enieje, like she rightly said, there's a perception out there that your charges are a bit exorbitant. And how would you encourage people out there, especially those watching, to just have that idea that it's not just like they think? What do you do as a group? I don't know whether you have anything in place like that to debunk that notion.
She mentioned that almost all the facilities have gone on the National Health Insurance Scheme. That alone is a guarantee that if you have an HIS card, you can access our services. So
what about those who don't have?
Yeah, if you don't have the NHIS card and you go to any of the government hospitals, you pay for it.
Yeah.
So if you come to our facility and don't have a card, you pay for it. But what we are saying is that even when you look at, even currently, we've been there, our organizations have been there for years. And you look at the patient profile, it's only 30% of our patient profile that come from the mother institutions. 70% are outside there. So already we are doing it. We have opened our doors, like she said, to the public. In fact, the confidence is there. Unfortunately, some of us are located in areas where we are the only medical facility. You can't go anywhere. So that perception, today want to raise it. But we have limitations. You know, our core businesses, here is with Ghana Ports, VRN, they are not health institutions. So our core businesses are not health. Our core businesses are varied. That's why we are saying that, look, we are opening up, want other partners to collaborate with us so that we can reach Ghanaians with whatever we have. And that's what the association stands for.
Okay. Can I add to that? Apart from that, our institutions also offer a lot to the Ghanaian public. We do training.
Yes.
For housemen, for residents, for nursing students, for allied, even health institutions. So we do more than what the institutions even has asked us to do. And we think that that is something that we need to, enhance, and then together with the Ministry of Health and other stakeholders, make it a formal role that we are playing. It's a formidable group, and therefore Ghanaians should know. They are there, military hospital, police hospital, SNAIT, the university hospitals, the Port Clinic, GAQHI. We have 22 members offering about 60% out of the 40% that is out of the government sector. And therefore, we think that it should be recognized as such.
Dr. Nab, Mr. Enieje talked about collaboration, calling for collaboration. Which institutions would you like to collaborate with?
Generally with all stakeholders in the health industry, the health sector. The main ones are the Ministry of Health, the Ghana Health Service, other non-governmental organizations which deal with health, and even amongst ourselves as institutions. And definitely health is not a preserve of a few. Health is a concern for everybody in the whole world. So we cannot isolate ourselves and be doing whatever we're doing. We need to get along with everybody who is dealing with the health of the people of Ghana, and for that matter. And so we are still looking. Unfortunately, we haven't done much on the front of the NGOs. We haven't collaborated much, but we are starting. We're in the process. So the Minister of Health, just about 2 weeks ago or so, we met with the Minister of Health, and they're looking at our proposals positively, and I think that we would be going forward from there.
Dr. GAQHI, Mrs., what are some of the challenges you're facing as of now? I know every group has a challenge.
Definitely.
The major ones.
The major ones. Some of our challenges is to do with training. Because our mother institutions have their core business, like the mining, power production, defense, and security, the attention to train health personnel is something that is not in the core business. And
just about 2 weeks ago or so, we met with the Minister of Health, and they're looking at our proposals positively, and I think that we would be going forward from there.
Dr. GAQHI and Mrs., what are some of the challenges you're facing as of now? I know every group has a challenge.
Definitely.
The major ones.
The major ones. Some of our challenges is to do with training. Because our mother institutions have their core business, like the mining, power production, defense, and security, the attention to train health personnel is something that is not in the core business, and therefore we think that partnership with Ministry of Health can help to train health professionals in these institutions to be able to offer quality health service to Ghanaians. In terms of postgraduate training, in terms of equipment, when there's the donor support, it should go to all health institutions. So if you have a group, then if they are, are sharing donor funds, then it goes to this group, an identifiable group, which be able to account. And we have the integrity already. We have the know-how, so we'll be able to account for whatever is given to us. So in terms of training, in terms of equipment, and then donor support.
Now, looking at the number of patients who visit such facilities, talking about equipment, are you able to cater for them adequately, although you talked about quality health?
Yes.
We do. In fact, the good news is that most of our facilities are able to give adequate care to our patients. Very comprehensive, very attractive. But the point is that, like she said, the core business of our mother organizations is not health. Yeah. So we have areas we could have covered if somebody else has partnered with us to care for Ghanaians. So basically, the situation, what we are doing is, now we have a desk in the Ministry of Health. We have an office. We have an office at the GMA Annex. We have a secretariat. And what we are saying is that, look, we will come to you, come to us, and deliver better health. For when you look at what happened in Tema recently, the first thing that came to our mind is, Ghana Ports is there, but it's a smaller facility. Are you getting me? If you have partnered and then put up a better thing, the overflow from the general hospital would have gone to that facility. And because we are all on the National Health Insurance Scheme, the charges at both ends would have been the same. So nobody will be losing. So there's room for expansion. There's room to do more than we can do now. And that is why we say, look, we are knocking at the door. Please open the door for us and bring us more to take care of Ghanaians.
Can I just add that these organizations are purely government organizations, just that we are autonomous. Yes. We pay ourselves. We even pay dividend to government. Yes. And when it comes to health is expensive for that matter. And so if government, for instance, I know that SHAG, that's the Christian Health Association of Ghana, government gives them support in terms of, they give secondment of staff, they paid some of their staff, but we are not even asking for that. We're asking for, just give us even more training, like Dr. GAQHI said, postgraduate training, give us certain equipment, even help us expand our facilities. And then that will take the burden off our mother organizations, and that will also help us to improve on our services to the public.
Finally, before we go, I'd like to end with you. What does the future look like for you as an association?
I think the future is very bright in the sense that with the 5-year plan, even with the Ministry of Health, it's stated in with the collaboration, public-private partnership agreement, it is there. So the future is very bright. We are already there. We are offering the services, but we even want to do more and with other stakeholders. And therefore, we think the future is very bright.
Okay. Thank you very, very much.
Thank you.
I think this all time will allow us, and it's been the Ghana Association of Quasi-Government Health Institutions calling for collaboration with all key players in the health sector to improve upon their delivery. Although they are doing their best, they want collaboration to really give of their best to the public. Thanks so much for watching, and coming up shortly is the sports segment.
Wherever you are, whatever you do, I am smiling at you. I am covering you. Discover the joy. Discover the fun. Be proud as Ghanaian. Together as one. Enjoy Tigo's nationwide coverage in every region. Cover more. Discover more.
Tigo, express yourself.
Bank on winning with Stanbic Bank. Oh yes, lots and lots of people are still calling to ask about Coolie Blue. And now, listen to that second chance opportunity that can only come from Stanbic Bank. The Coolie Blue Bank on winning promotion is back. It's bigger, better, and mind-blowing. The first prize is the latest, smashing, fresh from the plant Mercedes-Benz C180. Invest in the high-interest yielding Stanbic bonus investment account, and you stand the chance of winning the Mercedes-Benz C-Class. Plus, you get a bonus on your already high interest paid on your investment. Also, deposit and keep a minimum balance of 250 Ghana cedis in your Stanbic current account for each coupon, and qualify for the big draw to win a Mercedes-Benz C-Class. Users of Visa debit card also qualify for the side draws to win a ticket and paid for expenses to watch the FIFA Confederation Cup in South Africa this June 2009, and the big draw to win a brand new Mercedes-Benz C-Class. Everybody stands more than just one chance to win cool prizes with a Stanbic Bank Bank on winning promotion.
Stanbic Bank. Inspire, motivated, involved.
With the extras.
Every day, our body requires energy, vitality, alertness, and quick recall of events to ensure success. BX is a fortified B vitamin tablet and syrup from Amponsa and Fat Pharmaceuticals, and will help you and your family get through a day like this.
Release your energy, your blood shoot for your star. Strength to last all day.
A daily dose of BX tab or syrup enriched with vitamin C and zinc gives support to the body to ensure that it works efficiently and effectively to produce the day's energy requirements. BX syrup helps your children to grow well, be